Hello, everyone. I'm Courtney Hederman with AARP Illinois. Welcome to the very first session of our series, Medicare Matters. Medicare Matters is a partnership where we are going to be bringing you at home the latest and greatest essential information you're going to need to know, as well as it's going to come from one of our most trusted area agencies on aging, AgeGuide of Northeastern Illinois. I'm so happy to introduce today's special guest from AgeGuide, Val Guzman. Val is the Benefit Access Specialist, and he has been working on Medicare issues for so many years. So good day, Val. Good to have you, and so happy you're here. Now, we thought it would be really great to bring this series of Medicare information. Medicare gets everyone a bit confused and nervous, and we really don't want you to have that. We want you to feel as good as possible. So we're here to make those fears go hopefully away and everyone feeling as comfortable as possible. So when you're making decisions for you or for your family member, you've got all the information you need. And of course, where to find information and get those questions answered. But we have a lot to unpack, and we're really excited to be discussing Medicare with all of you. So for anyone watching, please feel free to put any questions you have to Val or to myself in the chat. And I'm going to kick off some questions, but again, if you have any, please put them in and we will be sure to answer them as much as possible. So remember, this is our first session, and this session we're going to concentrate on the basics, really the basics of Medicare, but we are going to go into a deep dive on Medicare Part A. So today is the basics and Medicare Part A. So let me get us started. I think really the best question and really basic question to kind of start us all off is, what is Medicare? Val, take it away.
Yeah, so definitely that's the big question. So what is Medicare? So Medicare is the federal healthcare system that is administered by CMS, or the Center for Medicare and Medicaid Services. And typically, for most people, you become eligible for Medicare when you turn age 65, but it is also available to people that are under the age of 65. Particularly for those that have a disability, but also certain health diagnoses or issues. Maybe the biggest or most common are end-stage renal disease, but also ALS or Lou Gehrig's disease. For those two in particular, you do become eligible for Medicare right away. But for those that qualify as disabled, you do have to wait 2 years or 24 months in order for your Medicare to start.
Wow, Val, that is so much good information. This is fantastic. Thank you. So, obviously we're talking about working, right? People have worked, they've paid into. So, what have those dollars been earmarked for? Those that have been working and paid into Medicare, where do those dollars go? What is it going towards Medicare?
And as far as what you pay into, as far as Medicare and those deductions that come out of all of our paychecks. So those payments or those taxes do go into the Medicare trust funds, and it's actually easiest to see it as we're the people that are working are the ones that are paying for people to be covered by Medicare. So it's not so much that it's money being set aside for your Medicare benefits. It's more so your children, your loved ones that are actually going to be paying for your Medicare benefits. And one thing that's key or important to realize is that even though you are paying into Medicare, Medicare wasn't designed to be free. So there are still some costs associated with Medicare as far as monthly premiums, co-pays that you pay when you go see the doctor, or if you have to go to the hospital. Sometimes that's a surprise surprise to people, but it was Medicare was never intended to be free. So just realize or prepare yourself that, especially those that are new to Medicare, there will be some costs, and sometimes it can be some significant costs.
Wow, Val, that is so much great information. Thank you so very much. Now, I think we really got to get into the ABCs of Medicare, and this is so this is where people really can get kind of confused because there's lots of different parts, right? And there's many pieces of each part, a lot of layers in all the parts. So there's Medicare Part A, B, C, D, all of that. So let's go through what are the ABCs of Medicare.
And so the quick basics of what the ABCs of Medicare are is there are different parts of Medicare. So Medicare Part A, that is your hospital insurance. Medicare Part B is your medical insurance. Part C is Part C is also known as Medicare Advantage, and these are private, your prescription drug coverage. These cover all of your prescriptions that you would pick up at a pharmacy.
Thank you, Val. That is perfect. There's so many pieces to that, so really appreciate it. So, obviously you've gone through the basics, which has been fantastic. And I know that we definitely want to focus on, specific parts so we can get a little bit more into detail. So let's talk and focus on Medicare Part A. What is Medicare Part A?
And definitely we'll focus on Part A. So like I mentioned, Part A is your hospital coverage. And you become eligible for Part A, again, under those same rules as for general, for Medicare is either when you turn age 65 or someone that's disabled. And the big thing to keep in mind is that is you do have to have a certain number of work credits or work history in order to qualify for what they call premium-free Medicare Part A. So that just means there isn't a monthly payments associated with Part A. It is also possible to qualify through a spouse if you don't have enough work history. But if you are still working, you actually don't have to either take a Medicare or sign up. You can choose to defer enrollment in Medicare. The key thing, or one of the key things to look into or focus on is if you do have insurance through an employer, or if you are covered through a spouse's employer, you'll definitely want to check in with the human resources or their benefits department to make sure that the coverage you have through the employer is considered what they call creditable coverage. So that just means that it is comprehensive coverage, that it is a valid substitute to enrolling in Medicare, because that way you won't be liable for any of the penalties that can sometimes happen if you don't sign up for Medicare when you're supposed to. Your benefits people can help answer that question. And And for most people, if you do have access to other coverage, you don't have to sign up for every part of Medicare. Uh, Usually, the most common is that if you qualify for the free version of Part A, you can sign up for that and defer signing up for Part B because normally there's a monthly premium for Part B.
Thank you so much, Val. That was so comprehensive. I think a lot of people, really struggle on when to take, Medicare, and particularly Part A, and especially when they have work still happening. So that was a great explanation. Thank you so much. So basically, though, what when you're looking at Medicare Part A, what does Medicare Part A cover?
And so, as far as what Medicare Part A covers, uh, Medicare Part A is your hospital coverage. And in particular, that is when you're in the hospital under inpatient status. So that's the key word, is whether you are an inpatient while in the hospital, because usually either you are an inpatient or you're in outpatient status. Uh, Hospitals are required to inform you what your status is when you're in the hospital, but I know when you're hospitalized, usually the last thing you want to think about is Medicare. But even if either if you don't remember when they mention it, or you can just go ahead and ask your nurse, what's my inpatient status, and they'll be able to tell you either you're an inpatient or an outpatient. Uh, so if you're an inpatient, that all falls under Medicare Part A. And what is covered under Part A, so most services when you are in inpatient status, that'll all be covered by your Part A benefits. Sometimes when you are hospitalized as an inpatient, sometimes your Part B will cover certain things. So it just depends on what's going on in the hospital and what you're in for. But for the most part, most of the care you receive as an inpatient will all fall under Medicare Part A.
Great, Val. Perfect. So obviously it covers a lot, and it covers 100%, but we do know that Medicare Part A doesn't cover everything. So what doesn't it cover?
And as far as what Part A doesn't cover, so it doesn't cover any benefits that actually fall under Part B. And as with most things Medicare, it won't cover you if it's not medically necessary. Usually, if you're in the hospital, usually it is medically necessary, but just in case, or keep in mind that if you are going into the hospital for maybe something like cosmetic surgery or some procedure that isn't being requested or ordered by a doctor, then yes, in that case, there is a chance that Medicare will not cover it.
Okay, so we now know what Medicare Part A covers and doesn't cover, but we got to talk the money. So how much does it cost?
And it says Medicare Part A. So for most people, it is free, but there are still some costs. For those people that don't have enough work credits, you could have to pay up to about $505 per month for Part A. Here, there are various tiers where if you have a certain number of work credits, but maybe not the full amount, this premium could be a little bit lower. But if someone does not have work credits or does not qualify through a spouse, then yes, you could have to pay the full $505. And there is also a Medicare Part A deductible. This does apply to everyone, but if you're everyone that isn't also enrolled in a Medicare supplement plan. So just to explain what the cost could be, just imagine this only applies to people that don't have or are enrolled in a Medicare supplement plan. So that Medicare Part A deductible, it is in 2024, it will be $1,632. And what this covers, or what you're paying for, is your entire hospital stay. So and it works. Medicare calls this time that you're in the hospital a benefit period. So the $1,600 covers you for that entire benefit period. And that benefit period ends once you've been out of the hospital or out of, say, if you have to go to a nursing facility, it covers you until you've been home from any of those facilities for 60 days. So it could cover you for quite a bit of time, depending on how long you need to be hospitalized. One important thing to know here is that this deductible is not like the usual deductible that you might be used to, where once you pay it, you're done for the year. Since this works with benefit periods, you could actually have to pay this more than once in a year if you don't have other coverage to pay for this for you. So definitely keep that in mind, especially when you're planning your costs for the entire year. If you don't have other coverage, sometimes hospitalizations can be very expensive, even when you're covered by Medicare.
Oh, Val, that was really wonderful information. Thank you so much for sharing. So you actually kind of alluded to long-term care, or when maybe someone is not in a hospital setting, but they're in a long-term care setting, like, and obviously Medicare doesn't really cover obviously all of long-term care, and obviously does cover some rehab and some skilled nursing, but really everybody does get confused on this. So what's the truth about long-term care, and what do people really need to know, and what to be prepared for?
Yes, it's definitely usually a shock that when someone does need that level of care, that it is in fact true that Medicare doesn't cover long-term care. Usually, the main way that people can have coverage for that is either by privately paying, signing up for, or paying for a long-term care insurance policy, and usually the way that most people end up having it covered is actually through Medicaid, the state health insurance program. And that's where it does there is a lot to plan for, definitely a lot to consider. But I think the most important part or takeaway is that you should know that it's not something you have to do alone. Usually, the nursing facilities have staff that can guide you through the process. There are also nonprofit MORSO workers, or care coordinators, they call them, that can also let you know what your options are, or how either you can access some of these other benefits through Medicaid and how to apply. Maybe one thing you would also want to look into is if you can, is also speak to an elder law attorney, because there could be assets that have to be managed, or there are ways to protect assets because that's also something they'll want to consider when you start planning for long-term care.
Yeah, perfect. I was just going to say about elder law attorney. So absolutely perfect timing. I know that Medicare, because again, staying in this kind of long-term care piece, or if someone was going to a rehab facility or any skilled nursing, there's this rule that Medicare has about consecutive days in a hospital to get any coverage for rehabilitation services. So maybe you can share a little bit about that particular rule and what people need to know.
Right, because that goes back to how Medicare Part A works, as far as it covers you when you're an inpatient in the hospital. And then, yes, there is a rule where if you do require skilled care after your hospitalization, if you have to go to a rehab facility for physical therapy, occupational therapy, it is required that you are in the hospital under inpatient status for at least 3 days. Again, this is another situation where the hospital staff are supposed to explain this, and usually they will, because they start to plan for your discharge almost immediately. But in case it is something that you think you need or want when it comes to rehab services, definitely just speak with the staff there at the hospital. Usually there is a social worker there that is planning your discharge. But yes, it is required for you to stay at least 3 days in the hospital.
Yeah, 3 days, and then you can be released to a facility, and Medicare is going to cover, right?
Right. And just so you have an idea of the coverage, if you do have to go to a rehab facility, Medicare will pay for the first 20 days in the facility. And if you have to stay longer than that, there will be a per day cost. But that cost can depend. If you have a supplement that covers that, most likely you won't have um, to pay that. But if you're not covered, then yes, it can be pretty pricey or expensive if you have to stay in the facility that long.
Yep. Great. Thank you so much for sharing all of that. Obviously, switching gears a little bit, but still with staying within Part A. One of the things that's covered is hospice, and so perhaps you can share a little bit about hospice care, even including hospice hospital care or other settings that hospice kind of takes place.
Yes, and the important thing to know is that your hospice care could be in either location. It could either be in home or it could be more of an inpatient facility. It really more so depends on what your needs are or what is recommended by your doctors. But yes, Medicare would cover either in-home hospice or as an inpatient. And your hospice care is fully covered by Medicare. There are only certain drugs or certain what they call respite care that sometimes there will be an additional cost that you're responsible for. But otherwise, it is fully covered.
And obviously those hospital or hospice nurses and physicians, I mean, they're like angels on earth, if you ask me. So I'm a huge proponent of hospice and all that they do to make people feel comfortable and, ultimately just have the most dignified passing as possible. So love hospice and all that they do. So thank you for that. So, obviously, you've talked a lot about Medicare Part A. So do you think there's anything else that people need to know? Something maybe I didn't ask or we didn't cover? What do you think if there's something else?
Well, I think maybe since there can be so many things to consider with Medicare, sometimes there are maybe just some obscure rules with Medicare that not everyone has to deal with. So I think the maybe just a good takeaway is that there usually are a lot of resources to help you, either through a program like the senior health insurance program that I'm a part of, where we have counselors that know the ins and outs of Medicare. So I would say just know that if you need help or if you're maybe running into a wall as far as finding an answer, there are people that can help.
Yeah, perfect. Yeah, so perfect timing. Actually, that was going to be my really last question for you, was on resources and where someone could find information about Medicare Part A, how to get some help. So yes, what are the other resources that people need to know about?
Yes, so I think one of the ones that I use the most is the Medicare website. It's medicare.gov. There is just almost any type of information about Medicare you want is all can all be found there. I think, of course, AARP has a lot of good information, and also AgeGuide's website, just ageguide.org. We actually just recently made a lot of updates to our website where we have access to video resources, and also just ways to more easily get in touch with a SHIP counselor, and even to have your questions answered directly on the website. So definitely always feel free to check any of those, either Medicare or AARP, but also AgeGuide's website.
Yeah, perfect. Great. This has been wonderful. Unfortunately, we're out of time. Also, please remember, open enrollment is October 15th through December 7th. If anybody would need to make any changes to Medicare plans. Thank you to Val Guzman from AgeGuide for being with us today. Your expertise is very appreciated, and we're so fortunate to have knowledgeable leaders like yourself. As Val mentioned, There are lots of resources. So aarp.org/Medicare, Medicare.gov, and AgeGuide.org. So there's wonderful resources. We're here to help. And as I mentioned, this is the first virtual event of our series, Medicare Matters with AgeGuide. So we're going to continue to bring meaningful and pertinent information. So in our next session, we'll be talking all about Medicare Part B and the difference between original Medicare and Medicare Advantage plans. So that'll be interesting. So feel free to share though other topics you might be interested in learning about in the chat. We'd love to hear from you. And of course, look for us next time and see you soon. Have a great day.